Action.
Okay, so I'm going to be this patient's nurse today. I've already checked with our computers and verified that this particular patient has an order from his provider that he needs an NG tube placement done. So I have gone in there and I have explained about the procedure and what to expect so the patient is aware of what we are going to be doing. I have got all my supplies. It is a clean procedure. I've opened up my packages and I have clean procedure gloves. And I have already washed my hands.
So I have all of my equipment here. I'm going to pick up the tubing and I'm going to first measure from his nose to his ear all the way to
First, I'm going to prepare
how long the tube should go
an extra amount of lube.
Nose.
This is to promote comfort during the insertion of a tube.
Down to the xiphoid process. And it's going to be about 60. After I did that, I'm going to go
And then I am going to remove my tube. And I am going to make sure that I have the patient covered with a towel in case they have any sort of leakage or vomit from insertion. And I will provide them with an emesis container and a glass of water. I'm going to make sure that I have my tube, and I will have document the French size, and then I'm going to need to measure the tubing before I insert, so I'm going to
just to make it a little easier on
measure from the tip of the nose
I have
to the ear and down to the stigmoid process.
nose to see which nostril he breathes out of better.
Measures at about 60. So I'm going to take the tube back and I'm going to make sure to mark my tube with some tape
in his nose.
so I know where I need to stop.
I'm going to try and curve it back. And once it hits the back of the throat, I'm going to turn it 180 degrees. And I'm going to put it in. After I do that, I'm still
And
holding
then
it.
now that I have my tube and I already have it measured, I'm going to go ahead
I would
and
usually have a
glue
nurse or have
as much as
Henry himself
possible
hold the cup,
onto my
but
tube.
I don't have a nurse at this moment, so Henry would be holding the cup as he drinks and as he's tilting his head. So I would turn it 180 degrees to ensure that it's going into his stomach and not into his lungs.
Clip it to my patient's
And I would continue putting in the tube all the way down to my mark.
Once your tubing is,
So I have it in at my mark.
you want to
And
make
I'm
sure
going to take
that
a piece of tape
that you
and
have
chevron style.
your patient,
Tape it.
you test them each nostril to see which side
suction.
gets the best airflow. We have already done so, and I will be inserting into the right nostril.
In the stomach by pulling out.
And they have already
Taped onto his nose so that it doesn't.
been cleared of any contraindications, so they have been able to blow their nose before this procedure
And then going
to clear their airway.
his shirt using a rubber band.
And I'm going to let them know I've got them in a higher position, and that to put their chin to their chest.
Back in there.
And I'm going to start insertion
So then I'm going to clip it to
slowly,
his t-shirt.
and
My suction machine on.
I will tell them that once I get to some resistance, I've hit the nasopharynx, and that they need to start swallowing from their cup of water. And now, to make sure that it doesn't go into the trachea and that it goes into the esophagus, I'm going to turn the tube 180 degrees towards their
Put it
ear.
in and I'm going to pull up some of the liquid. This is to check to make sure that we're in the stomach.
And continue
Instead of
inserting
doing this, we would just get a chest X-ray.
as quickly but efficiently as possible until I can get it up into
we're going to do this.
where I have
I'm going to put
pre-measured.
the fluids that I got from his nose
And make sure
Okay, and once I have got it to where I have measured,
got his
I
should
will
show numbers 5 and below, showing that it's acidic because it's in the stomach.
tape
If it
this
doesn't
down
show that, then
to
you want to
now I'm gonna
their
just
nose.
Just have it in for a couple of weeks or a couple days.
After I've done that,
I would
I've
explain to
checked.
him that we got
I'm
into
going to put it up to this,
and I would
and I'm going to check my orders
gather
and make
everything
sure
I need, trash
that
bag I would put here on the bed.
what number
just
that
getting
the doctor
too much
wants.
lube on
I
it.
would turn
So I'm going
It's
to go
not.
ahead and put it on.
Yeah, I just
and I
not
would
sticking.
unplug it from here, from the
And I have it where I need it to be, and so
and
procedure
plug
is
it so
over.
that
I'm going to make sure that
I want to
mine didn't stay on either.
Okay, it is. It is
It
taped.
is attached.
It is attached,
chart.
and then I'm going to take my syringe here,
Consistency
that way it gets
and I will remove this,
gastric acid that we're pulling out.
here,
so when I pull it out it doesn't come out with it.
and I will place my syringe in here
Henry's overall comfort.
I want to
and pull out some of the gastric contents,
Then I'll come back
and
and
I will use these contents
hopefully it will be this.
to test the pH level to make sure that I've gotten 5
Continued.
or less
So I
to
will
ensure that it
turn
is placed into
the
the
vacuum.
stomach.
After I do that, I'm going to check
And then
see, make sure everything's
I
still
will
right
and then clamp it.
based off of what I
hook
charted
this
earlier.
up to the suction. And
So
since
I'm
I
going,
already
after I
have
turn that off, I'm going
um,
to
Throw this in my
remove
trash bag.
looked at the
this. And
order,
of course, I'm going to check to make sure that there isn't.
I will
order to
connect this to the
discontinue.
shirt
Would make
And I'm
sure
going
that
to
or the gown and start the suction at what it has been ordered at.
he's not having any issues.
Or I will not start that. I will make sure that I will take them to get their chest X-ray to ensure
Before I start
proper
taking it
placement,
out, I'm gonna
as
tell
well as
Henry about
the
process.
pH strip.
I'm going to put the towel
And then
on his
once that comes back as
chest
positive,
to make
it's
sure
placed
that
good,
if he does
then I will turn on the
spit up
suction.
anything while we're doing this process,
Um,
that towel's there to keep him
And then I will go and I will document. I will make sure to document time and date. I will document the French size of the catheter and how deep it is inserted. And then I will document the gastric contents, their color, consistency,
to make sure that there's no stomach acid
smell,
still in the tube,
and then
because that won't feel very
I
nice
will
coming
also
out.
document
So I put
how
in
the patient
some air,
did with
clean out the tube a little
going
bit,
through the procedure. And
I
then
untape it,
I will put in any documentation for INO.
and I'll go ahead and throw that out.
And then once it is time for
I'm going
DC,
to tell Henry here to
an
hold
order
his
will be
breath.
placed. Once the order for
So
DC is
breath,
placed,
count 3, 1, 2,
I will
3,
come back
and then
in
start pulling it out.
and I will have kept up during shift on the INO of the suction bucket,
We would make sure that Henry's comfortable.
and I will inform the patient that it is time to discontinue
Document
their
that we
tube,
had discontinued
and
his nasogastric tube.
they will be relieved.
And
I left it myself.
And I will turn off suction. I will remove the suction tube from my angio tube,
and I couldn't speak.
And I do that every time.
and I will take normal saline
I know.
in my syringe and flush it through the tube to remove any of the excess gastric contents inside the tube before it gets pulled out. I will inform the patient it's time to pull it out. I need you to hold your breath. They will do so, and I will make sure it is quick, fast motion and without flying anywhere. And then once I have the tube removed, I will make sure to clean the patient's face up and to clean up my area and any trash and throw it away in the proper receptacle. And then I will also go document how the patient did with DC of the tube, any excess INO from discontinuing the tube, especially if they threw up in the process, and whatever daily care to take to clean them up afterwards, I will document.
Okay.